I'd like to very much thank the organizers for inviting me to participate in this really interesting webinar. My name is Sarah Borwein, and I am a Canadian physician who has lived and worked in China for 22 years now. I'm currently, for the last 15 years, the managing partner of a large expatriate-focused private primary care practice in Hong Kong. And prior to that, I worked in Beijing, where I ended up being the director of infection control for an international hospital during the SARS outbreak. And I want to talk to you a little bit about the response to SARS in 2003 in both Beijing and Hong Kong, and how that's informed the response to COVID-19 in Hong Kong, as well as the lessons that can be learned from that for the future. I'm not going to belabor this long because I want to get through this reasonably quickly. I want to say basically that in Beijing in 2003, you can sum up the experience with two expressions: information void and long delays. There was actually a 86-day delay between the first known case of SARS in November 2002 in southern China and the China notifying the WHO of the outbreak. And then another 30-day delay before the WHO issued a global alert. In Beijing, the probable first case was March 5th, but there was a 46-day delay before they admitted they had an outbreak. And so for much of that period of time, there was actually more or less a cover-up going on and very limited information that we were getting from tortuous sources that involve personal connections rather than reliable public health sources. Ultimately, there were 2,521 cases in Beijing, so it was actually the largest outbreak of SARS in the world. However, after April 20th, after the Beijing finally did admit to the outbreak, they did institute very strict public health measures and took some draconian action, which I think may sound familiar. So there were many closures of public places, schools, universities. Healthcare workers were actually quarantined in their hospitals for weeks. They built a 1,000-bed hospital in 8 days, and there was an appeal to patriotism, which was really very successful. So the local people, they stayed inside. And this photo is from a village near where I lived in Shunyi district. And it's a village that's basically barricaded itself to outsiders in order to keep SARS out. And it worked. By the end of June, the outbreak was basically over. The poem on the right is actually something that all frontline healthcare workers in Beijing received in July, along with a coffee mug to thank us. So there were a lot of lessons that were learned or should have been learned out of the SARS epidemic. We learned that delay is deadly. People die when you delay action. We learned that you can't hide an epidemic, at least not forever. That infectious diseases, they don't respect borders or government edicts. And it's really important to provide good, balanced, consistent public health information. You have to be honest, because if you don't, then you get panic or worse, denial, which spreads in an information void. We really realized more or less for the first time to what extent diseases can amplify in hospital and healthcare settings. And it was the first time we really used the term super spreader and realized how they can amplify disease. And it became very evident that the exotic animal trade is problematic for human health. And we also learned that old-fashioned public health measures, if comprehensively applied, can contain an epidemic. And I think that it's clear that we learned some of these lessons, but some places learned them more than others, and that the lessons were learned best by the countries that were most affected by SARS. In a way, SARS may have lulled some others into a certain complacency, because it didn't become a pandemic and it spread only when people were seriously ill. So it was easier to contain. And then when another coronavirus, pneumonia, started to circulate, perhaps many thought it would be the same thing. And I'm not going to talk about China much in this, except to say that China really did learn some lessons from SARS. But there's an expression in China that the mountains are high and the emperor is far away. Wuhan did not experience SARS and perhaps did not learn the lessons. Things would probably have been different had the outbreak started in Beijing, for example. But nonetheless, once Beijing did get involved, they did have an impressive and effective response to the epidemic. So it's a mixed story. The current epidemic was hidden for much less time, but it was still hampered at the beginning by some of the same things that happened in 2003. And what about Hong Kong? Well, Hong Kong was one of the places that really learned the lessons of SARS very well. It had massive economic consequences. It highlighted Hong Kong's vulnerability as an international hub, a neighbor to China, and it exposed all the weaknesses in our healthcare and public health systems. The picture is actually, honestly, a real but spectacularly poorly timed ad campaign that was run by the Hong Kong Tourist Association briefly in February 2003 before it got pulled. The legacy of SARS in Hong Kong, it's a really important collective memory. There are a lot of tales of sacrifice by medical workers. They're often repeated, and also the fact that the city rebounded afterwards is invoked to show its resilience and spirit. There's been a permanent rise afterwards in public health awareness and civic responsibility towards preventing illness. There's, as you probably are all aware, there's huge public acceptance of wearing facial masks. Even in non-epidemic times since SARS, people wear masks when they're ill. There's a deep distrust of China. Hong Kong residents here began taking measures this time as soon as rumors of a mystery disease began to emerge in late December. And on the other side, there's also been increased communication and collaboration between Hong Kong medical professionals and mainland doctors. We need to know what our neighbors are doing. And then after SARS, the government commissioned a report. It was called SARS in Hong Kong, From Experience to Action, by 11 experts, not just from Hong Kong, but also from mainland China, the UK, the USA, and Australia. And they made a number of recommendations that we must establish a Centre for Health Protection, which is kind of equivalent to our CDC. We needed to enhance our capacity for surveillance, analysis, investigation, and surge capacity. We needed to have a major outbreak plan in place and practice and drill it. We needed increased collaboration and communication with the Pearl River Delta and mainland China in general. We had to have a contingency plans to rapidly pull together a team of experts to advise government, improve the communication between the Department of Health and the public and private sectors, have clear policies for isolation and quarantine ready to go, invest more in infectious disease research, infection control, and cross-border research, engage the community in public health education, and address the medical and psychological needs of patients and their families. And I think it's fair to say that all of these things were done. The report was done not in a way, it could have easily been done to look for who was responsible or who was to blame, but it looked instead at what do we need to do better in order to make sure that we don't have this experience again. And I would say that this probably needs to happen in every single country after COVID. So when we got our first wave of COVID, it came from China, obviously. Hong Kong has huge exposure. We have a direct high-speed rail link with Wuhan. We have several road links with southern China, and we have massive air travel between the two countries, between the two areas. So we knew we were at risk. And we're a very crowded population. We have nearly 8 million people living in a very densely packed circumstances. So we were ready, I guess. The first letter went out to doctors on January 3rd, and on January 4th, the government raised its preparedness response plan for novel infectious disease of public health significance. In other words, there was already a plan in place ready to scale up for what to do if we get hit with a disease of unknown origin. And this was done well before we got our first positive case, which was January 22nd. And then the expert committee was convened on January 25th, and it consisted of 4 very well-respected infectious disease and public health doctors, some of whom are regarded as SARS heroes in Hong Kong. So they're highly respected by the local population. Border restrictions started to be imposed, culminating in a quarantine of all incoming travelers from China on February 8th, which essentially shut down cross-border travel. There's been near universal mask wearing. consistently escalating case finding and testing availability, extremely thorough contact tracing, and mandatory, not voluntary, mandatory isolation and quarantine. Schools and universities were closed, large public parks were closed, civil servants worked from home. So there was aggressive social distancing, but not lockdown. And public health education with consistent messaging has been a constant. And with that, so I'll just go back there. With that, you can see that's the epidemic curve for February. By the end of February, we'd really shut down local transmission. We had about 100 cases by March 2nd and no further local transmission happening. And that picture is from February in Hong Kong. Is I think the central MTR station. I challenge you to find a single face without a mask there, but you can also see that it's quite crowded and that people are still out and about. And even children wear masks here. That has been amazing to me, but they see the adults do it, and so they do it too. So then what happened was that we did get a second wave. And the second wave happened because many people had left Hong Kong in fear in January and February, thinking we'd get another SARS. And then they started to come home in March when the epidemic started to escalate in Europe and North America. And that resulted in a very rapid increase in imported cases in March, rising from 100 at the beginning of the month to 1,000 by early April. And you can see it in the orange line on that curve, the very rapid increase. And many measures were then taken in order to counter that. Primarily quarantine of all international arrivals. Eventually the border was closed to non-residents, so you can only come to Hong Kong if you're a resident, and then you will be quarantined for 2 weeks after being tested at the airport. And in fact, you not only have to be tested at the airport, you have to wait at the airport for the test result, which can take up to 10 hours. People are quarantined at home for the most part, but they are given a tracking bracelet to make sure that they follow it. Further limitations were placed on public gatherings, closures of certain kinds of venues, extensive use of remote saliva testing so that people home test for this. And with those measures, again, the curve flattened out, and by the end of May, virtually no more local transmission was happening. And that just shows the epi curve for Hong Kong with the large blue blip in March of imported cases. And in fact, most of our cases, only about 30% or less of cases are actually being ascertained because they were sick. The rest were from enhanced surveillance, and about 30% have been picked up at the airport. About 15% in the lower graph are actually showing that 15% of cases came from large clusters, and the contact tracing from those clusters was used to inform what needed to be shut down. So the current Hong Kong situation is that there are a cumulative 1,180 cases with 6 deaths in total. Currently only 86 cases in hospital. So we have the R0 less than 1 again. Mortality is very low. Testing is quite high. And almost all local cases are now imported, aside from one cluster of 9 cases in June. We've had no cases in long-term care or in frontline hospital workers. And so now most social distancing has been relaxed, but what remains is a ban on mass gatherings, more than 50, the border controls, and mask wearing. And I just put this up to show the transparency of information here. This is actually a website that was initially a protest website in the fall. It was repurposed to be a COVID information site. And on this site, you can find the contact tracing details for every single case in Hong Kong, along with information on scams that might be out there, on waiting times at the various hospitals, etc. So the lessons from Hong Kong's experience, which would be similar to the lesson from Taiwan and Singapore and other Asian countries, would be get ahead early, because the only way you can do what we did is to be ahead of the large tidal wave of infections. You need to have a plan that's ready to go and can be scaled up, and that aggressive early action is actually more important than getting it exactly right. You probably won't get it exactly right, but you will start. Wearing masks, in our experience, has been absolutely key. A silver lining from SARS for us was respect for public health and a community that has bought in. And so in some ways, SARS has been one of the best things that could have happened to Hong Kong, ironically. We have found that quarantines have to be intrusively enforced. People don't obey them consistently unless they are enforced. There's no one magic bullet. It's not all testing or all quarantine or all border controls. You need to do everything. And along with that, have consistent public health messaging so that the public listens to you. The public buy-in is an interesting thing that I'm sure will be talked about more, but there's a real tension between personal autonomy and public welfare. So a population that understands and is willing to give up some of their autonomy in order to protect the whole community, of course, makes it much more possible to contain the epidemic. Protecting care homes and frontline health workers where we've had no cases through diligent planning and drilling of plans. Self-testing has been pioneered here. What that means is that almost all community testing is done on self-collected saliva samples that patients do at home, usually after a telephone consult. And that means that, first of all, it's not painful like nasal NP swabs. And secondly, it doesn't put anyone else at risk. Also, another local lesson has been that early treatment is important. I think the local lesson has been that one of the reasons our ICU admission rate is so low, aside from the fact that we've obviously got quite a small percentage of people who've been ascertained because they were sick, but nonetheless, they really feel or see that when people are treated very early before the second week of illness, they're more likely to stay out of ICU. I suppose it's like the flu, where influenza, where if you take Tamiflu in the first couple of days, it's much more effective than later on. And we've really learned from our second wave that you must stay vigilant because it isn't over anywhere until it's over everywhere. And we did get some things wrong. And you have to remember that this epidemic, it could have been a disaster for us because the local government is seen as wishy-washy and indecisive. It definitely fumbled some of the early response. This epidemic happened on the back of 6 months of protests and civil unrest. When it started, there was actually a ban on face masks, and there was a lot of flip-flopping by the government on this initially until they realized that the population was going to wear them, whether they banned them or not. So perhaps, ironically, the ban on face masks made them more attractive. They also had some flip-flopping on delays on border closures. There was almost a doctor's strike to get them to close the border to China. Some early supply shortages, like everywhere. We had a toilet paper run, a shortage of masks and sanitizer initially, but it was all ramped up pretty quickly. Another thing we found was that we didn't properly pay attention enough to the large expatriate population here, which is less engaged with public health measures and confused by receiving different messages from their home public health authorities. I think Singapore had a problem with its domestic foreign worker population, which they hadn't probably given enough thought to. We think that fear of quarantine and isolation prevents some people from seeking care. The schools were closed for more than 4 months. Not clear this was necessary. With our retrospective scope, we might do it differently. And I think clearly what we're seeing now is that insufficient attention was paid to the mental health effects of all the social distancing and the closures and the economic uncertainty. We're definitely seeing those things now. So, but all in all, it's hard to really fault a response that's resulted in only 6 deaths in a very densely populated city that's right next door to the epicenter. So I just want to end by introducing our sort of subject of discussion of, will there be a second or third wave? Of course, we've already had our second wave, and we are kind of assuming we'll get a third wave, but no one really knows for sure because it's a novel virus. And there's never been a pandemic in history that didn't have one, but to our knowledge, there's never been a coronavirus pandemic either. So who knows? And sometimes in the absence of real containment, it's hard to assess whether you're having a second wave or you just haven't dealt with the first wave. When we talk about subsequent waves, most of the modeling is based on influenza, but this isn't influenza, so we don't know if the modeling will follow that pattern or if the timing may be different. Many patterns are possible. Key immunity data that would inform it remains uncertain. And of course, we hope that we'll have vaccines and treatments that can alter the course. Hong Kong's second wave arose because other countries hadn't dealt as effectively with their first wave as we had. So until the whole world has dealt with it, we'll all be dealing with it. And this will remain the case for quite some time, I think. But one thing to think about is, do we need a synchronized whole of world approach in order to fight future pandemics? Thank you. That's a picture of me and my husband in our Hong Kong issued surgical masks. One of the innovations that was done here was to make proper 6-layer reusable, washable surgical masks that have been distributed to every Hong Kong resident for free. So thank you.
Let me give you some information on the situation in France about COVID-19 and about the measures that have been taken. We have nearly 30,000 people who have passed away since the beginning of the epidemics, and more than 90% of them are 65 years old or over. We had to face a massive influx in intensive care wards, but it's now behind us. More than 200,000 people are tested each week now, and the positivity rate is low. It's in average about 1.5%. Now we investigate every cluster. Since the 9th of May, 269 clusters have been discovered in different regions in France. Lastly, we now worry about the situation in one specific department, it's French Guiana, where the virus is actively circulating. About the measures now. Like many European countries, we are performing a de-escalation of confinement measures with the reopening of shops, of schools, and more recently of restaurants and movie theaters. All the universities in our country remain closed until September next year, next academic year, and all events and gatherings with more than 5,000 people are forbidden for all summer. Our strategy in France is firstly to promote individual protection, to promote physical distancing, but also to develop accessibility to testing, which is quite an issue for us. And lastly, it's the detection of each cases and to perform a contact tracing for each cases, an investigation, an epidemiologic investigation. We have also developed an app, a Stop COVID application. This Stop COVID has been downloaded by less than 2 million people. So I think that it will be used if we have to face a second wave of the epidemics. Thanks a lot. Toda rabba.
I'm going to start off with something a little strange. Elizabeth Kubler-Ross, many years ago, which you may, described the 5 phases of grief, of grieving of a loss. And she described the first phase as being denial, the second phase being anger, the third phase being bargaining, the fourth phase being depression, and the fifth phase being acceptance. So I'm going to use that as a parallel to the pandemic. We went through the first phase of denial, starting something in China, not really serious, not going to affect us, few cases, even if there are a lot of cases, it's a Chinese problem. We get to anger when it spreads out of China and gets to Italy, and we start blaming people. Blame the Chinese, blame whoever spread it and whatever. We then go to the bargaining phase. And I'll explain why. The bargaining phase is saying, well, first of all, maybe we'll only have one wave and then it'll go away. There won't be any more waves. Or the virus will become weaker, it won't do so much damage. Or it'll become more friendly or something. Or it'll just disappear. And then the next phase, of course, goes into the issue of depression, because we have to accept that the virus is here. And there's no reason why there shouldn't be a second wave or a third wave or a fourth wave, because the virus doesn't know that there are waves. It's just looking for people to attack. So we'll go through a depression phase, I guess, and then an acceptance phase where we work. What I'm trying to suggest and ask you what your opinion is, that I think that the international community are at different phases. I think most now have passed the denial phase. They accepted it's here. Some are still focusing on anger. And you know, I'm not going to name countries, but I think you can guess which country. The Chinese did it. It must have been a deliberate thing. They should have told us earlier. Why didn't they do it? Instead of saying, okay, it happened. Let's get on with it, whatever. But there's still this focus on this kind of anger. The third phase is bargaining, and that's what I wanted to hear. Why shouldn't there be another phase? Is there another way? Is there any reason to suspect that if you put in a lockdown, you'll get a reduction, but the virus is still around? You lift the lockdown, it'll come back again. In fact, probably that's what happens in many of the pandemics. There's a change in the behavior of the population. You do all kinds of things. You slow down. You then feel everything's gone away. You lift it up and it comes back again. What happens later, of course, we can debate. And then, of course, we'll go through the depression phase. And I hope that we can get through that very quickly, because the depression phase almost makes you inactive. It inactivates you. You don't do what you should be doing. And then you'll get to the acceptance. So the question now is, do we really do what internationally, what some countries have done, and say we're going to lock down and just try and get rid of that virus to a very low level and work internationally at that level? And then work out a way of keeping it at that level. And then if the next wave comes, it doesn't inevitably have to be a very big wave, because we'll have tools that we know about that we can keep it at a lower level. And then work together until, of course, there is a vaccine. There are some who say until, of course, we get to herd immunity, and we can argue whether there's any sense in that, and so on and so forth. So I'm going to ask first Sarah and then Laurent to give me some comments. What, by the way, you don't have to relate exactly to what I said. You can make comments as you like. And Laurent, so open discussion. So let's start with Sarah and say if you have some comment to make.
Well, I think that's a really interesting kind of way of looking at it, and it does make a lot of sense. It's sort of the experience we had from here. I would add there was another phase for us, which was frustration, because early on, we were watching this wave roll out from Asia towards North America, Europe, the rest of the world, and no one would pay any attention. In fact, we often had the experience with colleagues trying to warn them, and people would not listen. They would not take it seriously. They said, it's just a flu, it's just a China thing, and we couldn't get people to listen. So I guess, you know, that's an interesting thing that probably won't happen again. In terms of what we do going forward, I think the interesting thing to look at is, I don't know if, when we look back, if all of the pieces of lockdown are necessary. So we need to find a way to contain or control this that we can live with. And we have to look at the pieces that were done that actually are effective. Probably not everything needs to be done that was done in order to stop it the first time. So, and of course, we never had lockdown here at all. We had social distancing, we had some closures, very targeted. And I think maybe going forward, that's a more useful approach, because you can live with it for longer.
Laurent, what would you? Let's hear from you. So it's really interesting what you said, and just perhaps to comment on that. Firstly, it was a crisis, and a crisis we have to face uncertainty. And if you don't have uncertainty, that means that it's not a crisis. So it's a new virus, and we had also to deal with that. The second thing also is, at least in France and in many European countries, we were not prepared with that. And for reasons that we can now just look at. The first thing is that we, as you said, the SARS, the first SARS crisis was very minor in Europe and even in the US and Canada. We had some cases, but it was not like that. We had to face Ebola, but Ebola was in Africa, and so on. So I think that Europe was not prepared with that. And the third thing, I think, is also with what you said. I think that we don't have enough knowledge on that, and and it's amazing how fast we improve our knowledge on this coronavirus. And this is something that will, I think, will be very important in the next months, because we will be more prepared. And I don't think that we have to face a second or third wave, because it's the same wave that we experience now in the world. But how we will deal in a few weeks and a few months, I think it will not be the same. At least for France, we now have masks, we now have all the individual protection. We know more how to have more flexibility in our healthcare system. So I'm not sure that it will be like what you said with the 5 phases, but there will be different phases. This is, I'm sure.
I'll go back to what you said, and Sarah as well. Sarah, you actually raised, I think, probably the most important issue, and I think Laurent related to it as well. Whatever we do, we're going to have to find the minimal kind of preventive measures that we need to make sure that the pandemic doesn't explode again. And on the other hand, maintain normal life as far as possible. Interestingly enough, in the United States, I've been following what's going on in the States, and in the same country, I've watched New York going from a crisis situation with huge numbers of cases and mortality. And I happened to watch the governor of New York giving his talks and following the way that he presents it. And with a very effective, shall we say, I don't know whether we can call it lockdown, but it probably was, but very impressive. Preventive has reduced virtually the caseload to virtually to zero. I just noticed now they had 0 deaths, going from 1,000. On the other hand, if you look at states like Georgia and Florida, where they're still going way up, they have opened up. They don't put many restrictions in place, although the caseload is going up dramatically. So I think that what we're saying is, let's try and now, if we talk about the bargaining phase, but let's go beyond it and say, okay, let's cope with it. And say, okay, we need to work together, because I would understand that in the United States, New York is going to be okay. And but at some stage, people from Florida and Georgia will be coming to New York. So that's going to, start things up in New York, or come to Hong Kong and so on. And if you do it in France, so we're all interrelated. So can we define at this stage that minimal kind of things that we should do? In other words, can we say masks, some social distancing, and maybe limiting very large gatherings, although even that I'm not sure. But I think the masks and the social distancing, do you believe that those two together could keep the pandemic at a manageable level if it was internationally imposed? What do you think? Start, Laurent, do you want to comment first, and then we'll hear from Sarah?
Okay, you can begin. I think that definitively we need more solidarity between countries, and also to experience for what has been done in one country to the other. And this I think is really important. And for us in Europe, we have seen how many different measures have been taken by the different countries. Perhaps we can do better after. Second thing, we have to learn from that. And it was really interesting, the presentation on the school closure. Many countries have begun, and France, like many countries, by closing the schools. But perhaps it was not the good thing to do. Perhaps some other closures were more important than to close the schools. And also we have to, and it's something that that is common in public health. It's how to balance between what we have to do for the community and how to deal with civil liberties and how to deal with individual liberties. And this also is a real issue for us. And I think that we can balance, and it was also interesting what Sarah was presenting in Hong Kong. we know that we have some measures to take at the community level, but we know that we have to preserve and mainly the vulnerable people. We had in France some experiences with some elderly facility in France. The situation was absurd because those people were dying from being isolated. So this is something that we have to think about.
Sarah, I'll hear you because I think you've got this experience, and I just want to make one comment about Hong Kong. Hong Kong is a real lesson to us, and I want to thank you for being in this presentation, because I noticed in some data that not only did you prevent COVID-19, you prevented influenza.
Yes.
So I think you've kind of fulfilled the Koch's postulates virtually in saying, do these interventions work? They do work because they work for other viruses. So they really work. Can you tell us which ones you think would be the best? If you said we wanted a minimal amount of it.
I think probably honestly the most important is wearing masks. If everybody wears a mask, is probably the single most important thing that can be done on an individual level. And then contact tracing is really important because it actually helps you inform where your clusters are coming from, and then you can take targeted action to shut things down if needed. And also what the risk factors are. You know, we sort of figured out that singing is a big risk factor. Places where people sing spread the virus. So, but you do that when you contact trace and you can see where the clusters are coming from. And I think probably mass gatherings are sort of part of that. But I also kind of think that one of the issues going forward is we've got this tension between countries that have managed to achieve containment versus countries that have mitigated the outbreak. And so for us, so there's a whole bunch of countries, mostly in Asia Pacific, that have actually contained the epidemic. Right. We're going to be pretty reluctant to let people in from countries that have only mitigated the epidemic unless we quarantine them and make sure they're not bringing it in. And that's going to create a problem going forwards between all of Europe and all of South America and then Asia. You know, how are we going to do that in the future?
So going back to Laurent, would you accept then that the masks, some kind of physical distancing that we may talk about, and contact tracing would be the three big things? Could we kind of say, okay, that would keep the economy going, that would keep us pretty organized? We could argue about big gatherings or whatever, but that, I'll just mention one thing before you answer. I've just arrived in Denmark, because my wife is working in Denmark. And I've come from Israel, and I flew from Tel Aviv to Denmark and stopped in Frankfurt. And I must tell you, first of all, I was on Lufthansa flight, and everyone was sitting close to each other. There was no distancing, but everyone wore a mask. There was nobody there on the plane who did not have a mask, and all the attendants. And at the airport, everyone wore masks. I mean, like, it's just amazing to see. At all airports, by the way, both Tel Aviv, Frankfurt, even in Copenhagen. And so I think that it's something that people are getting used to. And you just showed these little kids walking around with masks. I mean, even the little kids are getting used to it. So at least at this
schools
stage,
have gone back with kids wearing masks.
Right. So would you say that this is something that we could do to keep it at a level where society could function until sometime, or that it's, you know, at least it slows down to a level that we can manage it? And but again, we need a lot of cooperation. Laurent, what did you think? You were going to say.
You know, the question of wearing a mask is something in which, from the beginning of the epidemic, there is really an issue and some controversy on that. And I think also there are some cultural aspects in wearing a mask. I think that perhaps we need more and more knowledge on that and on the efficacy on that. And I think that at some moments of the epidemics, perhaps we need a mask. But why we need a mask is when we are not able to respect the physical distancing. Right. So Perhaps it will be what we will do in a few years in all Europe, but
Right.
I see now in the bars in France, let me tell you that all the young people, they don't wear at all a mask.
Yeah.
So, and we control the epidemics until now in France. So I'm not so sure. I think that we need some physical distancing. I'm sure of that. And I think that something that, because we don't know a lot on these specific epidemics. For instance, in France, all not the regions have been impacted by the virus. We have some regions in the east part of France, in Paris, in which there were a lot of people who had coronavirus, but some other regions where we don't have a lot. And our school is in Brittany. In Brittany, it's very rare to have, and even when we do testing now, sero testing, it's very low in Brittany. Why? We don't know. And I think that something that has to be also more investigated is the big gathering, because it seems that the big gathering is something very important for this specific epidemics. So we need more knowledge. I'm sure of that. And physical distancing, contact tracing is something that we know for years and years in epidemiology, and we know that it works. So I would say physical distancing and to avoid public gathering and contact tracing. Not exactly the same than Sarah.
Okay. Sarah, actually, there was a question there about what kind of, this will be, we're getting close to the end, not mass contact tracing. Do you have a big staff of people who are doing contact tracing in Hong Kong?
Yes, because it's mostly done just by shoe leather epidemiology. It's
Right.
not, you know, so there's a lot of people involved. I don't know the number, but it is quite a lot of people.
Well, it may be related to my age. I don't know about Laurent, but I also believe very much in the shoe leather epidemiology.
Mm-hmm.
And I think that we would have moved ahead faster if we'd not had these people telling to wait for the apps and wait for the technology. And I said, just go out and do it. And get people outside. I mean, you know, that's what we did, didn't we? When there was an outbreak, we just went out and investigated. I mean, there wasn't a question of whether there was a technology that would make it easier and so on. We went there. And I think that has to be done. But this is an opportunity for us to appeal to the governments and so on to expand dramatically the public health service. I mean, you need more qualified people. I think I spoke to Laurent about that. We virtually have no infectious disease epidemiologists in Israel. People just didn't go into that field. So there's a shortage of professionals, and we need to make sure that this is funded now. I mean, you can't suddenly produce a lot of people who are specialized in infectious disease epidemiology. It doesn't take a year, it takes years. So I think that's a last comment. We want to make a comment, Sarah, and then, or Laurent, you start, and then we'll give Sarah the last comment.
Just to be in line with what you said at the end, because now in France, we tried this contact tracing, and we investigated from the beginning of May 300 clusters. And it's with the help of the sickness fund, people who work in the sickness fund. And until now, it works. Without the new application, but it works. And I think at this level of the epidemics, if we do that correctly, I think it would be great. So the classical epidemiological mean is not so bad.
Right. Yeah. Sarah, I'll give you the last comment because Hong Kong is our shining star, the one giving us a beacon.
I think my last comment would be that, you know, we really should look at the lessons of history. And I think, you know, the Spanish flu and other pandemics can teach us quite a lot so a lot of things came out of Spanish flu. Universal healthcare, really came out of Spanish flu. Alternative medicine rose because doctors could do very little during the Spanish flu, and so people lost faith in classical medicine. So I think, but one of the big lessons out of Spanish flu was that the places that did the best were the places that consistently applied public health measures early and didn't let them up until the epidemic was truly over.
So now we need to join forces. We're doing it. I know we've got the collaboration to the European Schools of Public Health, who are doing a great job. And Laurent is a senior member there. So, and can't we bring Hong Kong into the European Schools of Public Health as well? I think we need that.
Yeah, there's a political problem. We're lumped in with
Yeah. We'll work out a solution. Yeah. Thanks very much to both of you and to all the speakers. Really was great. Wonderful that you joined us, and we'll keep in touch.